My name is Sana Penuga, and I would like to welcome you to my COVID-19 workshop. So, the main purpose of this workshop is to provide sound knowledge of COVID-19 and discuss the main issues that are surrounding the COVID-19 outbreak. So, let's get into it. So, from the start, we'll start introducing the COVID-19. What is COVID-19? How does it spread? The symptoms of COVID-19, and how can one protect themselves from getting infected? So let's start. What is COVID-19? Coronavirus, also known as coronavirus, it causes illnesses such as fever, coughing, and shortness of breath. And it is very, very contagious, and it spreads very quickly and causes severe illnesses such as pneumonia and even death. That's the worst case of it. How does COVID-19 spread? Number one, COVID-19 travels in droplets released into air by the person who has COVID-19. When that person coughs, sneezes, or talks near you, and you happen to inhale those droplets, then you become infected. And also, COVID-19 can be transmitted by touching, shaking hands, shaking hands, and you forget to wash your hands and you start touching your face and your nose and your eyes, then you can become infected. Number three, COVID-19 can be spread in through air, and it can infect people who are 6 feet away. So it's very important to wear a mask when you're in public. So now let's discuss the symptoms of COVID-19. It's very important to look at the symptoms. If you start experiencing two of these symptoms at the same time, it is very considerable to go and consult with a doctor because you might be infected with COVID-19. So the following are the symptoms of COVID-19, are some of the symptoms, not all. So, fever, coughing, tiredness, shortness of breath, loss of taste, loss of smell, diarrhea, vomiting, muscle acne, sore throat, headache, chest pains. These are some of the symptoms that you have to look at and you have to keep in check and to ensure that you are safe from COVID-19. And if you start experiencing these symptoms, you must consult with a doctor. So now let's move on and look at the ways of one can protect themselves from COVID-19. So the government implemented these rules and regulations that people should follow in order to minimize the infection rate, in order to protect themselves from getting infected by the COVID-19. So this is some of the rules and protocols that the people had to follow. So number one, very important one, wear a mask. Wear a mask all the time when you're in public spaces, especially when you're in public spaces. Please wear a mask because you cannot identify a person who has COVID-19 and someone who doesn't have COVID-19 because some people do not even have symptoms. They are just okay, like you. So you must wear a mask all the time. And number two, maintain social distance, especially when in public. Maintain social distance when you're in malls, when you're in the queues, on banks. Please maintain social distance. The third one, avoid touching your face, your eyes, your nose. Especially when you come home from a public space, please, when you get home, make sure you have a sanitizer by the door to sanitize your hands. And it is very important to have the small sanitizer in your bag so that whenever you touch something or you're in public spaces, always put on your sanitizer. But sanitizer is actually protocol number 4, that you should always wash your hands with sanitizer or soap. Those are the ways to protect yourself from number 5. How can I forget number 5? You encouraged. It's not compulsory, no one is forced to, but you're encouraged to get vaccinated. No one is forced to, but it's very much encouraged that you get vaccinated so that you can minimize your chances of getting infected by the virus. So, moving on to the issues that occurred, the changes that were made by the COVID-19 since its outbreak in 2020. So, COVID-19, we heard on the news everywhere about the virus that outbroke in China, taking people's lives, and we're like, okay, this is a very serious virus, but we never got invested in it that much because we were not impacted by it. We were moving on with our lives normally. So we took it very serious when the first case got reported. We're like, okay, I hope this gets resolved very soon. I hope the person that is got infected didn't infect other people. I hope that we're safe. I hope that the numbers won't increase. The person who got infected will get help and everything will just go back to normal. Little did you know that the COVID just hit our country. So I think we took it very serious when the first death case got reported. We were like, okay, now this is very serious. We are in for a ride. We are in for a ride, and it's not a good ride. So the government saw that, okay, this is very serious. People's lives are in risk. So I have to, implement some changes, come up with a plan to protect South Africans. And although some of the changes were going to affect people negatively, but at the same time, I think the government was trying to save their lives more than anything, you know. So on March 23, 2020, the president of the country, Cyril Ramaphosa, announced that the country will move to lockdown level 5, which meant that the country and the economy will stop operating for a while. I think it was 21 days. Will stop operating for a while until there is a control in the infection levels. To control the infection levels. So everything was shut down. Everything was shut down. People couldn't go to work. People couldn't go to school. Businesses closed. Business closed. People were required to stay at home and be quarantined, not visiting anyone or visiting relatives, be quarantined at home. Like, just lock yourself at home. That's what it meant. Just lock yourself at home. That's what it meant. Unless the person wants to perform essential services like going and buying essential goods, collect their grants, collect their pension, and collect their pension and seek medical attention, then the person can leave the house. Other than that, the person was required to stay at home, be quarantined. No social gatherings were allowed. Social gatherings were banned. Even at funerals allowed, I think, a maximum of 50 people. So social gatherings were banned and the borders were closed. Traveling between countries was banned in order to manage the infection levels. And the businesses were closed. Oh, that hit the country very hard. Businesses were closed. It meant one thing: people lost their jobs. People lost their jobs. People got retrenched. Schools were closed. Children were at home. A lot was happening, but we'll discuss retrenchment next. So lockdown level 5 was implemented in order to control the infection levels in the country. So moving right along to retrenchment. So as I was saying, lockdown came with a lot of changes in our country. As much as it was, the main purpose of lockdown was to protect South Africans from COVID-19 infections, But it came with the challenges, a lot of challenges and issues, especially to people of South Africa, especially employees. Like it hit employees very hard. COVID-19 hit employees very hard. So it came with a lot of changes. Um, some people who are not, who did not lose their jobs, had to work at home. You can imagine how it was because now schools were closed. Number one, children were required to learn and study at home, adapt in homeschooling, and the parents are also working from home. Now parents have to assist their children, in homeschooling, at the same time do their jobs. It was a lot. It was a lot, and many people lost their jobs. Sense of job security. It's job security, like there was no job security. You could wake up the next day and find that you're being retrenched. The company has closed down due to financial strains and all that. Like that took a toll on people's mental health, really hard. So moving right along, we'll have to discuss retrenchments. As I was saying, lockdown came with retrenchment, a whole lot of retrenchments. Some businesses were required to close down by the government. Government said that they must close down, such as salons, restaurants. Some businesses had to close down. So they were not making any money. They were not making any profit. So it put them in a very financial strain, and so they had no other choice than to retrench some employees because they could not pay them while they're sitting at home, while they themselves cannot make any profit. So they had no choice but to retrench the employees. Some employees were opened. Some businesses were opened, but only a number of employees were allowed. So you can just imagine that there is a few employees in the organization, so the productivity is very low. The business is not making the profit that they usually make, so now they have to cut costs. Cutting costs came with a price because now they had to retrench some employees. But it was very stated that employees should implement retrenchment as the last resort. They cannot just say we are closed down, we will retrench the place. Like they should look for other solutions, before implementing retrenchment. So yeah, retrenchment. I think South Africa always had an issue of high unemployment levels, but we never had such number of unemployment at a very short period of time. Like in the space of 3 months, like millions of people had already lost their jobs. So it was very hard for our economy. Like people lost their jobs, people lost job security. Mental health was at stake at this point because you don't have a job, you have family to feed, you don't have means to put bread on the table, as you are required by the government to stay at home, not go anywhere. Okay, now let's discuss the mental health of people during the COVID-19 retrenchment and the lockdown. Like I said before, lockdown led to retrenchment, and people lost their jobs every single day. And on top of that, they are being quarantined. Like that was worse. They are being quarantined. They lost their jobs, so they cannot make means of getting jobs, submitting CVs and hustling, and there was no means of doing that because they were required to stay at home. So even Some people were even triggered by the fact that now they have to stay at home, they cannot move. Movement restrictions, like it really took a toll on a lot of people. The fact that they had to stay at home, their movements are being restricted, they lost their jobs, they cannot make means of finding jobs, they cannot make means of putting bread on the table. It led to a lot of stress, it led to a lot of depression. Uh, it made them feel helpless. The fact that every single day they have to stress about the fact that what will we eat today? How will I put bread on the table today? It made them feel like they're worthless, like they lost their sense of wealth. Their self-esteem was bruised. Um, they were depressed. Some people were depressed. Oh gosh, some people will end up committing suicides because they feel like I'm useless anyway because I cannot help my family with anything. I cannot help my family with anything. I cannot help my children with anything because I've lost my job. I cannot get another job. I cannot make means of getting. You know what people might trigger their mental health the most is the fact that it was the quarantine. It was the quarantine, like the fact that you have to stay at home, like in between four walls, whole day, every day. It made them think about a lot of things. Some people got triggered about because when you're at work or you're at school or anyway, you meet new people, you talk, you forget about a lot of things. You forget about your stresses, you forget about everything as you have relationship with your co-workers, with your fellow students, with your fellow classmates. I mean, so you forget about a lot of things. So it triggered a lot of things being at home, having enough time to think about everything. Some people, so like I said, some people committed suicide because at least being around people help them to forget about a lot of things. Being around family, being around friends. Let's say your family is in another province, you cannot go and visit that family. You have to stay here. You have no friends. You have no family. Like it really triggered their mental health the worst. So like I say, mental health problems like increased every single day. People were very much depressed at that time, and the government tried in some way to distribute food parcels as much as they can, but that's not enough. A food parcel can a family of 10 with a food parcel, it barely lasts a week, and we have 21 days of of lockdown, and it got extended to make things weird. It got extended when people were like, okay, we were literally doing a countdown right now of the 21-day lockdown, and it got extended. People were frustrated, people were stressed, like oh, people's mental health was not okay at that time. It was not, especially when the lockdown got extended. It was not, because small businesses, like some people sell fruit and veg by themselves. Some people have small businesses that they open to feed their family. Now those small businesses are shut down, are closed down. What else will they do? What will they eat? That's the main question, because even the 350 social grants were introduced later on, and 350 is very legal. Some people have big families. It's barely enough for the person who stays alone. So you can think a family of 7 on 350. Like, it was not. It was not okay. It was not an okay state. I think the government was trying to save lives of people, not for them to be infected, but at the same time, some lives are lost not because of the infection of the COVID-19, but because of the suicides. because some people could not take it anymore. Some people, they could not take it anymore. So mental health became the biggest issue. After unemployment, mental health became the biggest issue in our country during lockdown and during coronavirus. And we had to deal with issues like, for example, GBV and child maltreatment, because now, since there was a quarantine, people found themselves having to stay with their abusers 24/7. In the country, we were still fighting the GBV levels. They were very high. During the lockdown, since the lockdown was introduced, like GBV, like it went uphill. Like every day, cases of GBV were reported. Some people were killed by their partners. Some people were being abused every day, because now you're seeing your perpetrator every single day. And like I said, mental health was a thing at that time. So now this abuser is stressed by not working, by losing their jobs, by everything that's going on. Take that stress out on the victim. Like it was, yeah. Gender-based violence went up during that time. All I can say is that. And child maltreatment, substance abuse, alcohol abuse. Closing off, I can say that COVID-19, it had no target audience. It affected everyone, from the adults to the children, from the rich to the poor. I can say it affected the poor more when it comes to food security, because the poor become poorer. The richest, at least, then they had their savings. It affected everyone. It was a deadly virus to begin with, so yeah, it was a deadly virus, but it didn't become deadly on those that were infected by it. Even those who were not infected by it, it affected them. So no positive outcome came out of it. No, it it messed up our economy in a big way, because some businesses still haven't opened until now. They were affected by the COVID-19 way back in 2020. They still haven't reopened now, because they do not have the capital to reopen their businesses again, as they were impacted by the COVID-19 lockdown. They spent that money that they made for food security and other stuff. So when the government announced that everything goes back to normal, they already spent all that money on food security and their necessities, so they could not reopen. Some people are still unemployed till this day, because their employees shut down the company, so they're still unemployed. Some people were retrenched, and I think now some businesses have picked up their profits and all that stuff, so they are functioning well now. They are functioning well, and they employed other people. So in place of those that were retrenched, some people were employed in their places. So it will take time for South Africa to recover from the impact of COVID-19. It will take some time. It's not it won't take months or few years. It will take some time for our country to be the way it was before the COVID-19 outbreak. So yeah. Thank you for listening to